There is so much talk about heart disease and stroke these days. The Heart and Stroke Foundation of Canada says heart disease and stroke are the #1 killer globally. Can you believe that? Globally, heart disease and stroke are the #1 killer. Well, if you have been asking, what is a stroke and how do you recognize the signs of a stroke if you were having them, or if someone you knew were showing signs? Well, I will be answering those questions right here. Today's topic is recognizing the signs of a stroke. My name is Genese Smith, and I am a certified transformational life and dream builder coach, as well as a registered nurse. And I wanted to share with you some useful health tips that you could use along the journey as you trust me into helping you turn your dreams into reality. Today, I wanted to share with you 3 things. First, 2 acronyms you can use in recognizing the signs of a stroke. Second, I wanted to share with you my story of what happened when I had a stroke at the age of 32, 10 years into my nursing career, and why I did not recognize the signs at first. Third, I want to share with you 2 highlights. 1, some subtle differences in women, and 2, why you should never, ever, and I repeat, never, ever consider driving yourself or even asking someone to drive you to hospital, even if you're 5 minutes away, once you suspect a stroke. All right. So you may be asking, what is a stroke? And to my knowledge, a stroke happens when blood supply to any part of your brain is interrupted, preventing brain tissues from getting oxygen and nutrients and damaging brain cells. And brain cells start to die within minutes. And the effect of the stroke depends on where in the brain it was damaged and the amount of the damage done. Stroke is a medical emergency. And I wanted to stress here that prompt treatment is critical. In other words, treatment has to be fast. And that's why we use the acronym FAST, so that you can recognize the signs of a stroke quickly. So let's look at the acronym FAST. F-A-S-T. F is for face. Is it drooping? Maybe go to one side, right? And then you look at the A. Can you raise both arms? A is for arms. Can you raise both arms? All right. S is for speech. Is it slurred or jumbled? T is for time. Time is critical. Time to call 911. Remember, act fast, because the faster you act, the more of the person you can save. And the more you can recognize the signs of a stroke, the more you can help someone having a stroke get the emergency help they require. And that's going to lead us into the second acronym. And as I talk about the second acronym, I just don't want you to be confused on which acronym you're going to use. You can use any one of the acronym. Most persons will just stick to the first one. But the second acronym is B FAST. B is for balance or dizziness. E is for eyesight. Eyesight is blurred or lost in one or both eyes. F again, is for face. Or you can look at the smile. Is the smile uneven? A is for arms. All right, so you're looking if there is sudden weakness in the arms. S is for speech. Is it easy to understand? T is for time. We go back to the time. Time is critical. Time to call 911. And the faster you can help someone get help, the better it will be for them. All right, so we've finished the first section. And before I dive into my story, I'd like to remind you to subscribe to the channel. Remember, just press subscribe because I'm going to be sharing with you some awesome tips as we go along this journey. Sounds like fun? All right, and I know you've been really waiting to hear about my story of what happened when I had a stroke at the age of 32. As I said, it was 10 years into my nursing career. And as I look back, I was scheduled for evening shift. And I remember vividly, I can remember everything that happened. I remember the phone ringing that afternoon. And when I answered the phone, it was the unit clerk on the phone. At the time, I was working at the hospital. And she said to me, Genese, are you not coming to work today? And in my head, I'm asking, why is she asking me that? I'm like, of course. So I said, of course, yes, I'm coming to work today. And she says, well, the shift has started and you're not here. And I found that strange. But anyway, I'm thinking, okay, I'll get to the shift. But then before she hung up, she said, you're talking funny. Like, and I'm like, what do you mean? She said, I can hardly hear you. Like, you're not speaking clear. And in my head, I'm just thinking that, okay, she said it's time to go to work, so I'm not paying attention. And as far as I'm concerned, I'm speaking okay. I'm like, okay, well, all right, well, I'll be at work now. And I hung up the phone. And I started getting ready for work. And there was something off, but I just couldn't put my finger on it. And I'm just getting ready to work, and I put my clothes on, get my stuff ready, went to the garage, get into the car, and I was out. And I'm driving along the road, and at the time I was living in Renfrew, so I'm coming down along Edmonton Trail, and I'm driving. And there's just something that feels weird, but I just can't put my finger on it. And I just said, let me just call one of my friends, one of my nurse colleagues. And I called and I said, you know, I just don't feel right. There's something not right, but I can't put my finger on it. But other than that, I feel okay. And she said, you know, Genese, call 911. So by that time, I'm on 16th Avenue heading towards the hospital. And I dialed 911 and they asked me, where are you? And I said, I'm driving along 16th Avenue and I'm looking to where I am. And they said, put your hazard light on. And I'm looking in my vehicle and I can't find my hazard light. I'm like, where's the hazard light? I can't find the hazard light. And then they asked me, what can you see around you? And I remember seeing that Midas sign. And I said, well, no, I can see the Midas sign. They said, okay, just stop right where you are. And I stopped in the middle of the road. And I could hear the ambulance coming behind me. I could hear the sirens going. And of course, they took me to the hospital. And I remember being in the emergency department. And in my head, all I'm thinking is that, I'm overreacting. I just need to go to work. And I remember saying, I was wearing my scrubs at the time. And I remember saying to the doctor, okay, yes, you know, I have to get to work. And I remember him saying to me, well, you're not going anywhere. I mean, you're having a stroke. And at that time, it really hit me. I'm like, a stroke? I'm too young for a stroke. I can't be having a stroke. And it was so much to learn from the experience. I was off work for a few months, you know. I mean, I lost my peripheral vision. I lost some other functions. And I was off work for a few months. I remember that. But without getting into all the details of the story, what I wanted to point out to you that's so important, that there are times when the person who is having the stroke may not recognize it, and it's someone else will recognize the signs before you do recognize the signs of a stroke. All right? And what I'd like you to do, I'd like to have some engagement from you, and I'd like you to just put a comment below if you have had a similar experience, or if you know someone who have had an experience like this, or if I'd like to challenge you, if you remember the acronyms, do you think that you'll be able to recognize the signs of a stroke using the acronyms that we went through already? Put in the comments below yes, if you will be able to recognize the signs of a stroke below. All right, so we're just going to go into section 3 that I promised to deal with, about some subtle differences in women. So both men and women may experience stroke differently, but there are some common signs that both men and women will see that they experience at the time. So both will say they experience some balance issues, loss in coordination, confusion, drooping of the face, as we say, and they may have some weakness in the arms. There may be some paralysis in the face or in the arms or leg, and oftentimes one part of the body. So we have some common signs experienced by both men and women. But for the women, sometimes the symptoms are vague. And because of that, people may not associate these symptoms with the signs of stroke, and it may go for a long time without recognizing it, because sometimes women may report some signs such as hiccup. They may report nausea, or they may report fast heart rate or short of breath. And a lot of people don't associate these signs with the signs of stroke. All right, so it's important for you to know that men and women can experience it differently, but it's just important that you can know these other signs that women may experience sometimes. And I'd like to also deal with the topic of driving. And while it may seem like the best choice initially to drive someone who is having a stroke to the hospital, the fastest way to get the best treatment is by calling 911. And when you call 911, these staff know the hospital that's best to take you to, that will deal with stroke patients. Also, when you call 911, while you're in the ambulance en route, they have already started treatment. They have contacted the hospital. They can contact the stroke specialist. Whatever blood test that needs to be done can be started. And they can also start booking for you to have a CT scan right away. During the route, they are actually starting the necessary intervention. Whereas for you, when you drive to the hospital, you have to go through admission. You have to go through what they call the triage in emergency. And as I tell you, with stroke, the quicker you start intervention, the better. So you do not want to delay. So remember, if you know someone that's experiencing a stroke, no matter how close you live to the hospital, call 911 because prompt treatment is important. Remember, the brain cells start dying within minutes, and you can save a life. And that's it for lesson for today. And if you need to get those acronyms, reach out to me and I will send that to your inbox fast at no cost. Thank you so much. Bye for now.